Ever wake up with a mouth as dry as the desert? You're definitely not alone in this experience. Waking up with a dry mouth isn't just uncomfortable, it can impact your oral health, your mood, and even your energy for the day. That sticky, parched morning feeling is common for many people, but it's not something you have to accept as normal. Today, we're diving into the 5 most common reasons you might wake up with a dry mouth, and what you can do about each one. Let's get started right now. Let's kick things off with the most straightforward reason: dehydration. It's something we all know about, but often underestimate just how much it can impact our bodies, especially when it comes to waking up with a dry mouth. Not drinking enough water during the day is a huge factor in dry mouth. It's easy to get caught up in work, errands, or daily routines, and simply forget to hydrate. Our bodies lose water constantly, through breathing, sweating, and even talking. Every breath you take, every step you walk, and every conversation you have slowly depletes your body's water reserves. If you're not replacing those fluids, your mouth is one of the first places to feel it. The tissues inside your mouth are especially sensitive to changes in hydration. Many of us rely on coffee, tea, or soda for hydration, but these drinks can actually make things worse. Caffeinated and sugary beverages can act as diuretics, causing your body to lose even more water. Water is the real MVP here. It's the purest, most effective way to keep your body and mouth hydrated. When you don't get enough, your saliva production drops, and saliva is crucial for keeping your mouth moist and healthy. Saliva not only helps with swallowing and digestion, but it also protects your teeth and gums from bacteria. Overnight, you're not drinking, so your fluid reserves are already lower. Hours without water while you sleep means your body is running on whatever you had before bed. If you went to bed a little dehydrated, it's no wonder you wake up parched. Even a small deficit can leave you feeling uncomfortable in the morning. Even mild dehydration can lead to a noticeably dry mouth in the morning. You might notice cracked lips, a sticky feeling, or even bad breath. So what's the solution? Track your water intake. Use an app, a journal, or even a simple checklist to make sure you're getting enough. Aim for about 8 cups a day, but adjust for your activity level and climate. If you exercise, spend time outdoors, or live somewhere hot, you'll need even more. Sip water throughout the day instead of chugging it all at once before bed. This helps your body absorb fluids more efficiently and keeps you hydrated around the clock. A small glass of water before sleep can help, but don't overdo it unless you want midnight bathroom trips. It's about balance. Enough to stay hydrated, but not so much that it disrupts your rest. Keep a glass of water on your nightstand for a quick sip if you wake up dry. This simple habit can make mornings much more comfortable. Hydration isn't just about quantity. What you eat matters too. Many fruits and vegetables are packed with water and can help you stay hydrated without you even realizing it. Foods with high water content, like watermelon, cucumber, or oranges, can boost your intake. Including these in your meals or snacks is a tasty way to support hydration. Set reminders or use a water bottle with time markers if you forget to drink. Little nudges throughout the day can help you build a lasting habit. Making hydration a habit can make a world of difference for your mouth and overall health. You'll likely notice more energy, better focus, and even improved skin. Dehydration is often the simplest problem to fix, but it's also the easiest to overlook. It's a small change that can have a big impact. If you address this and still find your mouth dry, it might be time to look at other causes. But for many, simply drinking more water is the first and most important step toward waking up refreshed. Now, let's talk about mouth breathing, a surprisingly common habit that often goes unnoticed, but can have a big impact on your health and comfort. Even if you're drinking plenty of water throughout the day, breathing through your mouth while you sleep can leave your mouth feeling like sandpaper by morning. You might wake up with a sticky, parched sensation that's hard to shake, no matter how much water you drink. This is especially common if you're dealing with nasal congestion from allergies, a cold, or even just the natural shape of your nose. Sometimes, structural issues like a deviated septum or enlarged turbinates can make nose breathing difficult, pushing you to breathe through your mouth instead. When you breathe through your mouth, you bypass your nose's natural humidifying and filtering system. The nose is designed to warm, moisten, and filter the air before it reaches your lungs, but mouth breathing skips all of these important steps. The air flows directly into your mouth, drying out your saliva and the delicate tissues inside your mouth and throat overnight. This dryness can make you more prone to irritation, discomfort, and even increase your risk of cavities and gum problems. If you wake up with a sore throat, chapped lips, or a scratchy voice, these could be big clues that you're mouth breathing at night. Over time, these symptoms can become more than just a nuisance. They can start to affect your overall well-being. Sometimes, you might not even realize you're doing it. Mouth breathing can be a sneaky habit, especially during sleep, and many people only discover it after noticing persistent dryness or discomfort. Chronic mouth breathing can also affect your dental health, leading to more cavities, gum disease, and even contribute to bad breath. Dentists often spot the signs before you do. So, what can you do? Start by addressing nasal congestion. Try antihistamines, nasal sprays, or a saline rinse before bed to help clear your airways. Keeping your nasal passages open is key to making nose breathing easier. Use a humidifier in your bedroom to add moisture to the air, especially in winter when indoor heating can make the air extra dry. This can help soothe your throat and mouth overnight. If mouth breathing is a habit, train yourself to keep your lips closed during the day. Practice mindful breathing and check in with yourself regularly to make sure you're using your nose. Special chin straps or mouth tape can encourage nasal breathing if you're struggling, but always use these products safely and consult your doctor if you have concerns about your breathing at night. Elevate your head with an extra pillow or try sleeping on your side to open up your airways. Sometimes, a simple change in sleeping position can make a big difference. If these tips don't help, see an ENT specialist. There could be an underlying issue like nasal polyps or a deviated septum that needs professional attention. Breathing through your nose is what your body was designed to do. It supports better oxygen absorption, helps regulate your body temperature, and even boosts your immune system. Restoring that natural process can make a huge difference for dry mouth, sleep quality, and your overall health. You'll likely notice you wake up feeling more refreshed and comfortable. Don't ignore persistent mouth breathing. It's worth addressing, not just for comfort, but for your long-term health and well-being. Another big player in the dry mouth game? Medications. While we often think of dry mouth as something caused by dehydration or certain health conditions, the truth is that the pills we take every day can have a surprising impact on our oral health. Many common prescriptions and over-the-counter drugs can cause dry mouth as a side effect. Antihistamines, antidepressants, blood pressure meds, and more. Even medications for allergies, anxiety, pain, and colds can be culprits. In fact, hundreds of medications list dry mouth as a possible side effect, and sometimes people taking multiple medications are even more likely to notice it. These medications can interfere with your body's ability to produce saliva. They may affect the nerves that signal your salivary glands, or change the chemical balance in your mouth, making it harder for saliva to flow naturally. Saliva isn't just about comfort, it's your mouth's defense system. It helps wash away food particles, neutralize acids, and protect your teeth and gums from harmful bacteria. When it's in short supply, your mouth can feel dry and uncomfortable, especially in the morning. You might wake up with a sticky feeling, cracked lips, or even a sore throat. If you recently started a new medication and noticed more dryness, check the side effects list. Sometimes, the connection isn't obvious until you look for it. Never stop taking a prescribed medication without talking to your doctor. Your health and safety always come first, and your provider can help you weigh the risks and benefits. Mention your symptoms at your next appointment. Your provider might adjust your dosage, suggest alternatives, or recommend ways to manage the dryness without changing your medication. Saliva substitutes and mouth sprays are available over the counter for temporary relief. These products can help keep your mouth moist and make eating, speaking, and swallowing more comfortable. Avoid caffeine, alcohol, and tobacco, as these can make dry mouth worse. They dry out your mouth even more and can irritate sensitive tissues. Chewing sugar-free gum or sucking on sugar-free lozenges can stimulate saliva production. Look for products with xylitol, which can also help protect your teeth from cavities. Good oral hygiene is extra important. Brush, floss, and use toothpaste for dry mouth. Keeping your mouth clean helps prevent tooth decay and gum disease, which are more likely when saliva is low. Regular dental checkups can help catch issues early. Your dentist can spot signs of dry mouth and recommend treatments to protect your oral health. If you use inhalers, always rinse your mouth afterward to prevent dryness and oral thrush. This simple step can make a big difference. Medication-induced dry mouth is common, but manageable with the right strategies. You don't have to live with discomfort. Small changes can bring big relief. Work with your healthcare provider to find solutions that keep you comfortable and protect your smile for years to come. Now, let's discuss a more serious cause: sleep apnea. This condition affects millions and often goes undiagnosed. If you're waking up with a dry mouth, especially with loud snoring or gasping for air, sleep apnea could be the culprit. Sleep apnea causes you to stop breathing for short periods at night, leading to mouth breathing and dryness. Other symptoms include excessive daytime sleepiness, morning headaches, and waking up unrested. If these sound familiar, seek medical advice. A sleep study can help diagnose the issue. Left untreated, sleep apnea can contribute to high blood pressure, heart disease, and more. Treatment options vary. Lifestyle changes, CPAP machines, or dental appliances may help. CPAP machines keep your airway open and can reduce mouth breathing and dryness. Some CPAP machines have built-in humidifiers for extra comfort. Addressing sleep apnea doesn't just help with dry mouth, it can improve your energy and long-term health. If you use a CPAP and still have dry mouth, ask your provider about humidification options. Dry mouth can be an early warning sign, don't ignore it. Getting professional help can make all the difference. Finally, let's talk about alcohol and caffeine. Both are diuretics, causing your body to lose more water. That evening glass of wine or late-night coffee can set you up for a dry mouth come morning. Alcohol is notorious for causing dehydration by suppressing the hormone that helps your body retain water. Caffeine, found in coffee, tea, and sodas, also has a mild diuretic effect and can disrupt sleep. If you're sensitive to caffeine, even an afternoon cup can impact your hydration and sleep. The solution? Limit alcohol and caffeine, especially before bed. Swap evening drinks for water or herbal tea to help with dry mouth and sleep. If you do indulge, drink extra water to offset dehydration. Avoid mixing alcohol with sugary mixers or caffeinated energy drinks, they're even more dehydrating. Moderation is key. Small changes in your evening routine can make a big difference. By tweaking your habits, you can reduce your risk of waking up with dry mouth. Start your day feeling more refreshed. So there you have it, 5 common reasons you might wake up with a dry mouth and what you can do about each one. From staying hydrated and addressing mouth breathing, to adjusting medications, screening for sleep apnea, and being mindful of alcohol and caffeine, small changes can lead to big improvements. If dry mouth persists despite your best efforts, reach out to your doctor or dentist. Persistent dry mouth can sometimes signal a more serious condition. Thanks for watching. Like, subscribe, and share your experience in the comments. Stay hydrated and healthy. Let me know if you need further tightening or adjustments.